Henderson,
Here.
Jennings, excused, Mr. Chairman.
Excused, yeah, excused.
Roscoe,
Here.
Sweeney,
Here.
Yin,
Here.
Mr. Chairman.
I'm here and
Representative Baker.
he's,
We have 8 present, 1 excused, Mr.
Perfect.
Chairman.
okay, I want to thank the public for coming back, sticking around with us. And we've got one other little, before we start working these last 2 bills, Representative Hallinan.
Thank you, Mr. Chairman. I move that we reconsider House Bill 189. I voted negative, and I'd like to change my vote on that. Thank you, Mr. Chairman.
Okay, so Representative Hallinan was on the prevailing side. And so as a member on the prevailing side, he's moved for reconsideration of that vote. That's not debatable. So we'll simply call a roll call on reconsideration. So the question is, do we want to take up the vote again on House Bill 189? That is the Representative Hunt's bill on flared gas burning we heard this morning. So can you please call the roll on the reconsideration, the vote on 189?
Representative Baker.
No.
Gray.
No.
Hallinan. Henderson.
Aye.
Jennings. Excused. Roscoe.
Aye.
Sweeney. Okay. Conflict, that's right. Yin.
Aye.
Mr. Chairman. Mr. Chairman, we have 5 ayes, 2 noes, 1 excused, and 1 conflict. The conflict being Representative Sweeney. Jennings is excused, and the noes are Representatives Baker and Gray.
Okay, very good. Well, thank you. Now that bill is back on the table and the motion is do pass as amended. And so please take the roll on House Bill 189. Motions do pass as amended.
Just a moment here.
Sorry.
Okay. Representative Baker,
No.
Gray,
No.
Hallinan,
Aye.
Henderson,
Aye.
Jennings excused, Roscoe,
Aye.
Sweeney conflict, Yin.
Aye.
Mr. Chairman.
Aye.
Mr. Chairman, once again, we have 5 ayes, 2 noes, 1 excused, and 1 conflict.
Okay, thank you.
Okay?
That'll be reported out of committee, Representative Hunt. Okay, next bill for our consideration is House Bill 211. And Vice Chair Henderson, maybe tell us what your plan is here.
Thank you, Mr. Chairman. I don't want to take too much time here. My purpose in bringing this bill was because we have so many new people in the House, and we're a newly formed revenue committee. And as you all know, we have very limited choices regarding our revenue sources. And property tax is one of them. And so I was talking to a lot of private industry and public people too. I said, what could we consider? Everyone remembers our beloved chairman, former chairman of the Revenue Committee, Chairman Madden. He recently had an article which caught my attention and really helped motivate me to look into this more. And it's a 1-page solution to Wyoming's budget crisis. And in that, Chairman Madden highlights the role played by property taxes as a balancer in terms of, between the needs and the cuts. And so I've provided to the committee, each one of you, a 1-page summary. Simply stated, House Bill 211 raises property taxes for all classes 1%, phased in over 4 years equally. And so I wanted to know what could that generate? Well, it's $215.4 million. Well, you know, and I know, everybody involved here is going to have their own take on property taxes. And so I would like to move that we go ahead and table this and consider this as a topic for the interim study, because I think we're going to do a very in-depth review of all things revenue. But on this one-page sheet here, I would just like to highlight for the record, and in respect of any public that may be participating, my aim here, as you know, our property taxes, the majority of them, go a long way towards funding our quality schools for Wyoming. Wyoming has the lowest property taxes in the United States. As I said, 215 million total revenue projected over a 4-year period. Raising potential revenue is a way, I think, to balance between the needs and the cuts. And the last time property taxes raised in Wyoming, well, I haven't verified that question yet, but I suspect some of the members in our legislature were still in school when they were last raised. I have provided to all the representatives in the House a very interesting link where you can go in and enter information as to a property value and calculate the tax. I have some other links that I found. I'd be very, very interested in sharing any information I've been able to accumulate. But that, sir, is, Mr. Chairman, is pretty much all that I have to say. And as I say, I'd ask for your indulgence. I regret any inconvenience, but I think the best thing to do at this point, all things considered, is to table this for the time being.
Okay, any comments by the committee? The public that's here? Okay, appreciate, and I think we're going to continue this discussion and education. So appreciate your handout and bringing this bill forward. And we've been blessed, there's no doubt. Minerals pay half our property taxes, and it's been a blessing. And so we'll keep working. Okay. The next bill that's been re-referred to us now is House Bill 162. Representative Romero. And I would say, Representative Romero, here's what my timeline on this is. It's right now 6:57, and we're going to have a decision on this within 20 minutes. So I'd like you to explain your bill in 5 minutes. I think it's a pretty straightforward bill. And then committee will ask questions. We're going to go to public comment for about 5-10 minutes. And then we're going to work this bill. We're not going to spend 2 hours working this bill. I think we all understand this issue. And we appreciate it. And I've heard from hundreds of people on both sides of this issue. And but I want to hear your bill, and then we're going to work it. Okay, so thank you. Representative Romero Martinez.
Thank you, Mr. Speaker.
Former speaker, Mr. Chairman. Yeah.
Once speaker, always speaker.
Yeah.
And Mr. Chairman and members of the committee, today I present to you House Bill number 162, Medical Treatment Opportunity Act, and I ask for your favorable consideration. It's an act related to Medicaid, requiring collaborative concerning the expansion of Medicaid eligibility and authorizing the expansion of Medicaid eligibility as specified, requiring reporting and notice as specified, repealing prior authorizations, providing a sunset provision, and providing for an effective date. Speaking to your comment, I would say that you guys probably know this issue a lot more than I do, because especially for the people who have been here. And also because some people have either worked something similar, voted on it before, or heard issues. I'm just going to freestyle and just talk like a regular human being. I'm just a basic guy, common guy. But, or should I say, in addition to that, it's been a frequent topic. Expanding Medicaid to uninsured people whose income is at or below 138% of the federal poverty level has been discussed for a long time. And I think I can mention names here. My cousin was one of the first to bring it up, Senator Floyd Esquivel. And I didn't support it back then for some specific reasons related to the ACA. And I'm just going to be blunt here. When the ACA was passed, it only got passed at the federal level if I'm not mistaken. I think there were 9 pro-life Democrats that went to midnight or whatever to work a deal with the Obama administration at that time. Didn't want to see federal funds go to abortion. So I thought we could do something like that at the state level, but I didn't know what the rules were. I guess you can't. Found that out through Legislative Service Office. So that was frustrating to me. And I get that. But these are things that bobble in a citizen's mind. I was born here, and I'm still here. And I'm one of the people that's not insured. I'm probably the poorest person in both chambers. So I got a bone to pick, but it's not about me picking a bone. It's about there's thousands of people. They're saying approximately 24,000 residents that are not currently covered under an expansion that we have failed to produce. And I know that sometimes reaching across the aisle is not considered cool because everybody gets into partisanship. I did reach across the aisle. Mr. Chairman, I even called you. I thought I'm going to call the chairman, the former speaker. I didn't think you were going to even give me the time of day. You did. And next thing you know, you were in support. I reached out to Minority Leader Connolly and Provenza, and I even got another forward-thinking individual, Mr. Zwanitzer, and so it's a bipartisan bill. I don't know all the answers. I got about 3 minutes and 50 seconds, so I'm going to wind up so we can get through this. When I looked at the version coming across from the other side of the Senate, I went and talked to the gentleman. He was excited to have a conversation with me. And I just want us to figure out a way to get this through. I don't know how to do that. That's your body. Doctor and Reverend, he would prefer to be called, Reverend Martin Luther King said, the last civil right that we will achieve will be healthcare. This is it. 2021. If our vision wasn't clear in 2020, maybe that little 21 good luck number will take us there. I got 4 minutes and 37 seconds. I digress. I beat the clock. Please give me your favorable consideration. And if you don't, I understand you vote your conscience. And I digress. I end. Thank you, Mr. Speaker.
Well done. Thank you. Any questions for Representative Baker?
Thank you, Mr. Chairman. I just have one question, and you referenced the bill coming from the other side. I see that on your bill, you don't have any senators, but that bill has co-sponsors in both bodies. What's your feeling about that bill?
Go ahead, Representative Romero.
I feel that the bill coming from the other side is clean, meaty, and tough. What my bill is near a clone of what was put through, I think it was a joint resolution. And so I think to achieve some kind of crossover, well, first to address your first point, I did reach out to the Senate, but the people that I reached out to didn't like the idea. There's been a little bit of a back and forth there, a little teeter-totter going on there. And I maybe didn't work the floor well enough. I didn't talk to all 30 folks, so I would say maybe that would be weakness on my part. Other than that, I think there's maybe we change a date or something, but I think we want to, I would like to see it to where it's, I read in a Wyoming political science book at Laramie County Community College that there is a way to achieve making it work where we're at right now. That's up to the pleasure of this body.
Okay. Any other questions? Good, Representative. Okay. Thank you. I'm going to move now to public comment. And folks, I would like to, again, brevity is really appreciated. We want to move about 10 minutes of public comment. And I think, and then we want to get to work on this bill because this is our last meeting, right? And we got to, so public comment. And if folks here in the room would like to come forward, we've got 2 staging areas here. You could just come right up and sit next to Representative Romero Martinez, and then that'll save time. Are there folks online And
Yes, Mr. Chairman, I currently have 14 hands up in the, 15 hands up in the
And I-
Zoom waiting room.
I would just say we probably won't get to all 15 of you. And I just want to be, so I think when you hear something said, in fact, we're going to probably just talk right now. If everybody's in favor, let's say, I want to hear somebody who's against it. And I'll be closing that thing. And so why don't I first start off? Let's start off with those who are against it. How about I do that? And then let's see what the hands do online. So if you're against the bill online and you want to talk, raise your hand. Does that change the?
I currently have 3 hands up in the Zoom
Okay.
waiting room.
So we're going to go against the bill and then we're going to go for the bill. We got 5 minutes. Those folks who are against the bill, so you can take all 5 minutes yourself or you can yield to others who are online. So please introduce yourself. Thank you for being here tonight.
Thank you. Thank you, Mr. Chairman. Thank you, members of the committee, for allowing me to testify on this bill. My name is Hayden DuBois. I'm a visiting fellow at the Opportunity Solutions Project, which is a nonprofit organization looking at welfare, workforce, and healthcare solutions. Now, some of you may have been presented with, or may be presented with tonight, a rosy picture painted by advocates of Medicaid expansion, one that touts federal money is paying for a new population. Unfortunately, this picture is not based in reality. What I can present is the facts based on the actual experiences of other states that have expanded Medicaid to the unfortunate detriment of their budgets, as well as their most vulnerable residents. One need only look just north to Montana. Montana lawmakers, when they passed Medicaid expansion, were assured it would never exceed 59,000 individuals. It currently stands at 97,000 able-bodied adults. That's a 64% overrun, which matches the 65% increase in Medicaid spending that Montana has seen since it expanded Medicaid. In fact, in the year just before Medicaid expansion was implemented in Montana, it consumed roughly 15% of Montana's budget. Today, just 4 or 5 years later, it consumes more than 25% of Montana's budget. In other words, 1 in every $4 of Montana's budget is going to Medicaid, while the state's share of spending on both education and transportation has declined over the same period. Nor were hospitals saved by this welfare expansion. Today, Montana has fewer hospital beds and ICU beds per capita than its 2 non-expansion neighbors, Wyoming and South Dakota. Indeed, after expansion was implemented, Montana hospitals reported a 21% increase in Medicaid patients, but a 30% decrease in patients with commercial insurance. Meanwhile, the uninsured trend was left unaffected. It was trending downward prior to expansion. That trend simply continued. Put simply, tens of thousands of able-bodied working age adults were kicked off their private insurance and enrolled onto taxpayer-funded Medicaid, all while thousands of truly needy Montanans with chronic conditions or developmental disabilities were stuck on waiting lists, languishing for care. In Wyoming, the picture would be equally depressing. Medicaid expansion would cost $2.7 billion over the next decade, of which the state would pay $270 million, which the state doesn't have. All of this would be in an effort to enroll roughly 42,000 able-bodied working age adults, while hundreds of vulnerable Wyoming residents are stuck on waiting lists currently. Further, because Medicaid reimburses providers at a far lower rate than commercial insurance does, many of the roughly 60% of potential expansion enrollees who have insurance through their jobs right now would be moved on to Medicaid, causing estimated hospital shortfalls of 16.3 million, the equivalent of about 300 lost hospital jobs. Now, some of you may have heard some recent misrepresentations related to Obamacare's Medicaid expansion, specifically as it relates to the recent COVID relief bill. To be clear, Wyoming would not receive $120 million from the feds if it expanded. This is a gross overestimation by a liberal group. 25,000 residents would not gain coverage. A much more accurate picture based on actual results from other states is 42,000. The state portion of Medicaid expansion would not be 10 million a year. It would be 27 million a year based on actual results from other states. The current 50-50 cost split for Wyoming's traditional population would not be updated or renewed with a 90-10 split. The state would continue, except for a brief temporary period, to be to
You
pay
got about 30
50%.
seconds, so then your
Okay.
5 minutes is up.
Okay.
Thanks.
Insurance premiums would not decline, and any small decline in uncompensated care costs would be far offset by an increase in decrease in Medicaid reimbursement rates. Indeed, a provision in the COVID Act would actually provide free federally paid for health insurance for those earning between 100 and 138% of the poverty level. So the choice is this: allow these individuals to receive new private coverage paid for by the feds at high reimbursement rates, or move them on to Medicaid with lower reimbursement rates with the state picking up a portion of the costs. The choice is clear. for the solvency of your budget and the care of the truly needy. I ask you to reject this bill. I thank you for your time, and I'd be happy to
Okay,
answer any
thank you. Any
questions.
questions? Members of the committee, any questions? Okay, appreciate you joining us tonight.
Thank
Thank you. Are there folks online?
Yes, Mr. Chairman, would you like me to admit the 3 people who raised their hand wishing to testify
You
in
bet.
opposition?
Appreciate it. And yeah, we can admit all 3 of you and then brief comments, and then we'll wrap up those against, and then we'll go to those in favor, and then we're going to work the bill. Okay, I don't see anybody appearing.
Mr. Chairman, I admitted the first, Virginia Vincenti. I'm going to lower hands again because more hands have gone up, and ask people in the waiting room who are in opposition to the bill to raise their hand again. So anyone in the Zoom waiting room in opposition to the bill, please raise your hand again. Mr. Chairman, I've admitted 2, Virginia Vincenti and Sherry Lowell.
Mr. Chairman, I'm not against it. I don't know whether I signaled wrong.
Okay.
Mr. Chairman, I admitted a second, Sherry Lowell.
Okay.
Hello?
Hello, I think we can see you and hear you. You're opposed to this bill.
I'm opposed to the bill because it is a,
Hold on just one second. Now,
Okay.
you could go ahead and introduce yourself, where you're from and where you're at actually right now. And then with just a few brief comments and respectful of everybody's time. So a couple minutes, please. So go ahead. Thank you.
Okay. I'm Sherry Lowell. I live in Gillette, Wyoming. I'm currently at my home in rural Gillette. I'm speaking against the bill as it's been presented, going to a committee, because we actually have, I think, a clear avenue to the funding provided by the Recovery Act. And we have people in the state who have already been needy over the years. And with the Recovery Act, we are able to provide for people who have also now lost their jobs due to COVID and who were once insured. So I would like to see the 162 bill be coordinated as presented by the representative who presented it, making this bill more clean way to actually getting Medicaid funded in Wyoming. Thank you.
Thank you very much. Any questions? Well, thank you for joining us, Miracle of Technology.
Okay. Thank you.
Yeah, thank you. No snow in Campbell County.
Not very much.
Not like here. Goodness gracious. Okay, thank you for joining us. Okay, we're going to move to those in favor, and that was kind of quasi in favor, I think. But we'll give each other a little grace on the Zoom. Folks here in the room that want to speak in favor of this bill, Minority Floor Leader Conley.
Thank you, Mr. Chairman, members of the committee. I'm pleased to be here, having brought up this issue several times over the past couple of years. But there are a couple of nuances for this year. First of all, we know that the healthcare outcomes of states that have had Medicaid expansion for the past 5 years are better. That was one concern. Is this really going to help? And the answer is absolutely yes. We know that we have approximately 24,000 people that would be eligible right away. And I also want to make sure that when, if not if, there are additional layoffs in the extractive industries that we're able to keep our folks here. And one of the main reasons that people leave this state quickly is that there isn't affordable health insurance. This bill will help that. I also want to point out, and I know that you have an amendment before you that I very much appreciate and support as a co-sponsor of this bill, that acknowledges that the federal government has for us $120 million on the table. Up until this year, we would have needed to put in some general fund money for a return. Right now, that's not the case. We will get $120 million. We also can have sideboards in this bill regarding the federal match. We can put those sideboards in so that we will not participate if the federal government ever has us go below those matches. So with that, Mr. Chairman, and very briefly, on and in favor, and I hope we move it along this year. Thank you.
See none, we'll move to online. And if there are any state agencies, I don't see anybody here. But any state agencies are online.
Mr. Chairman, we can't hear you.
The miracle of technology, you have to turn your mic on. My apologies. I said we're going to move. There's no one in the room currently that wants to speak in favor of the bill, any additional people. So we're going to move to online, but I do want to say that I want to hear from anyone in state agencies. So here's what I'd like to do. Just take a couple more minutes and actually, I think I'm going to just pause this comment. And I heard that we have someone from the Department of Health. I can't see that. I don't. So if we could admit anyone, any state agency folks.
I'll do that, Mr. Chairman. I believe we have 2 members from the Department of Health. I want to let you know I also had admitted an additional person who had raised their hand in opposition. She is currently in the room. Would you like to take her testimony first?
Yeah, go ahead. I think so. We'll give each other a little pass here because we're bouncing in and out of Zoom. We can see you, ma'am. We can't hear you. So if you'll unmute and introduce yourself, tell us where you're at. I can't. Is it Deborah? Yeah, just unmute.
Yes, I'm not actually in opposition. I was told not to put my hand down.
Okay,
But I would very much like to speak on the mental illness.
Okay, we're gonna first
side of this.
do agencies.
Okay.
State government, thank you.
Yes. Good morning, or sorry, good afternoon, Mr. Chairman, members of the committee. My name is Franz
This rate,
Fuchs.
Franz, if we keep going at this rate, it will be good morning. So we're gonna right along. Appreciate all your work. Appreciate
Chairman,
you.
it's been a long day, sorry.
Yeah, no, appreciate you being here.
So Mr. Chairman, members of the committee, again, my name is Franz Fuchs. I'm a policy analyst, Department of Health, coming from my house due to the snow. But just here to answer any questions that you may have. We certainly can present a summary of our report on expansion costs, as well as a summary of the American Rescue Plan provisions that might add additional revenue to the state, but really here at your disposal.
Very good. Okay, thank you. Okay, we have anyone else, any state agencies? Franz, I think you're the only one. We'll keep you right here online. And then Deborah, I can't read your last name. Is it? Miss Hinkle. Welcome to the committee. Go ahead and introduce yourself and where you're at.
Thank you. I'm Debbie Hinkle and I'm from Laramie. And thank you, Chairman, for allowing me to speak. I am speaking, I have a lot of experience on the mental health end of this. My son was diagnosed with mental illness in 2000. He ended up in the state hospital in 2005. One of the things that I really noticed when he was there is on the way out the door, after he'd spent 5 weeks, the first thing they said to him was, or said to me was, well, see you in 6 months. There were good things that happened there. Since then, I've seen the mental health funding deteriorate. I started CIT in Laramie, and we actually had people that were from the state NAMI group. I've been the NAMI president in Laramie for 14 years and also served on the mental health board for 3 years for Albany County. So I've had a lot of exposure to what's going on with the people that are dealing with mental illness and their families. What I've found out is that as you've had to cut funding, there's been more and more and more problems with people with mental illness. We are #1 in suicide. We are 48th as far as adults that are dealing with mental illness and then their ability to access any sort of services. We are 50th as far as the youth that are able to access services and dealing with mental illness. They cut the funding for the CIT person that was there, and they were going to take it over by the state. And there's been some CIT done, and I don't know whether you know what CIT is. If you don't, please ask. It just keeps decreasing. On the mental health board, I have seen people sitting in the jail in Laramie, Wyoming for over a year waiting for money or waiting for evaluations from the state Evanston people to come in and actually evaluate them. And then you've also put a prerequisite in there that they had to evaluate them twice. So as they're sitting in the jail, a lot of times they deteriorate more, and then they get other charges against them because maybe they've attacked an officer or another inmate, and there's just no help for them. People have looked for places to go.
I'm going to ask you to kind of bring us home here in the next 30 seconds or so. Thank you.
Bring you home. I can tell you that as you continue to cut funds, it's just going to cost you more. People end up in the hospital. I talked to someone yesterday whose daughter ended up in the hospital in the behavioral health unit. Their out-of-pocket cost was $5,600, and that was for 3 days, which is your typical Title 25 situation. And so it's probably $8,000, which nobody with mental illness can even begin to pay. Sure. And so the hospitals are getting stuck with that, and you're bringing down the rural hospitals. So there's got to be some changes here. This needs to be fixed.
So you're in favor of the bill?
Oh, yeah.
Okay. Well, thank you for joining us. We appreciate it. And is next on public comment?
Mr. Chairman, I admitted Dr. Ryan Jackson.
Okay. Dr. Jackson, welcome. Introduce yourself.
She goes for a glass.
I think we got a, there we go. Okay. Can't hear you. I'll have to unmute.
Sorry about that. I'm Dr. Ryan Jackson, and on this bill, I'm representing the American Cancer Society Cancer Action Network. And they've done a lot of research into Medicaid expansion, and it shows that there's a significant difference in access to cancer screening for the people who have Medicaid versus those who don't. And so in the states that have expanded Medicaid, we're doing more screenings and we're finding cancer sooner, which if you know about cancer, the sooner we find it, the more likely it is that we'll be able to actually cure it rather than having those people die or go through years and years of expensive and terrible chemotherapy, radiation therapy, and other things. So the American Cancer Society is very much in support of expanding Medicaid, and every state that has expanded has continued to widen the gap in early detection and quality of life and the outcomes of for all of these different types of cancer. And that's beside all the other who are the working poor who are trying to get better jobs, but they can't afford to get a better job because the health insurance won't kick in fast enough for them to be able to afford to go from $10 an hour up to $20 an hour. And so this would be kind of a way to help our people get on their feet and become more independent.
Thank you. Any questions for Dr. Jackson? Okay, thank you for joining us. Let's take two more and then we're going to close off public comment. Thank you.
Mr. Chairman, I've admitted Maggie McAllister.
Good evening, Chairman and committee members. I'm Maggie McAllister. I'm from Pinedale in Sublette County. And I just wanted to get on and ask you to please support the Medicaid expansion bill. I'm 60 years old and I've lived in Pinedale since 1992. I've served my community in many areas: lodging, real estate, technology, and more, notably with the local food movement. I was on the original Wyoming Food Freedom Coalition board, of which Wyoming is forefront in our nation. I founded the Pinedale Farmers Market, Sublette Local Food Alliance, and Local Fest. I am a farmer in my community since 2006. I have no health insurance. On health.gov, my premium would be upwards of $1,200 a month with no pre-existing conditions. Farmers are essential workers, yet many struggle to pay for health insurance and are usually underinsured. A lot of the time, one of their spouses works to provide income and health insurance. I'm a single farmer and I don't have that luxury. I would postpone going to the doctor because I have no coverage. So if I got sick, I probably would just not go and try and cure myself. My 20-year-old son works in a restaurant in Casper, and he also has no health insurance. He was covered by Medicaid until he turned 18. He does not make enough to afford any health insurance. I spent a few years working in Colorado after my divorce. I was eligible for Colorado Medicaid. I found work at a seed company down there for a year, and I made $2,000 a month, and I was still eligible for a no-cost health plan. Back home in Wyoming, I do not have health insurance. I have been blessed with good health. I cannot dwell on what if scenarios. What if I got COVID? What if I got cancer? Likely, again, I would not go to the doctor. Everyone needs and deserves access to affordable quality health care. Updating Wyoming's Medicaid saves lives. You guys have the power to pass this on and give access to 25,000 more Wyoming residents, utilizing those new federal funds. I'm here to ask you in advance to advance this bill out of committee, to give a hand up to so many Wyomingites that not only deserve health care, but it may also save lives. I thank you all for your consideration, and I stand for any questions.
Well, thank you for joining us from Pinedale. Any snow over there? Missed you guys too.
It missed us, went down the other side of the winds.
Yeah, for sure. Any questions for Ms. McAllister? Okay, thank you for your testimony. Okay, one more, and then we're gonna start working the bill.
Mr. Chairman, I admitted Marcy Kindred.
Okay, good evening.
Good evening. How are you?
I think we saw you this morning.
Yes,
Yeah.
I didn't get the memo that we were meeting tonight.
Okay, welcome.
Thank you. I just want to thank you for your patience and your time. I know it's been a long day, so thank you for hearing public comment. I'm Marcy Kindred. I'm here in Cheyenne, House District 8. And I've been giving testimony urging legislators to pass any bill that expands Medicaid in any capacity for a few years now, and I'm here to do it again. I usually do my best to present a case of my Medicaid success story. Look at what Medicaid did for me and my family. Look at what a contributing member of society I am now. I would like to use air quotes on contributing member because I will say I was very much a contributing member of society living in poverty. I just now have the tax bill to justify it. I guess, but I attribute my current success to the vital support Medicaid and other government programs provided for my family. And so I come here and I try to convey that this support should be extended to others who so desperately need it. I am an eternal optimist, so I usually like to look on the bright side of things and lift up the good. But today I think it might be helpful to tell you some stories about how our current system failed me and my family. Just a couple. I'll be quick and I talk fast. You may or may not be aware that while Wyoming Medicaid covers pregnant women that fall below the, I think, 154th percentile of poverty level, that coverage ends 60 days after giving birth. Bam, no more, regardless of the circumstances. And I happen to be one of the 15% of women that suffers from postpartum depression, varying from moderate to severe with each of my 4 children. With my first son, I was 19 and I didn't know what was wrong with me. And I can't help but wonder if I had been able to continue under the care of a physician, they could have realized the signs and saved me from a very dark time. Months and years that I'll never get back with my son. And while my subsequent children, I received the necessary medication within a few weeks after giving birth, I weaned myself off of that medication once my coverage ran out because I couldn't afford to go to the doctor to continue to fill my prescription and monitor that progress. I know I don't have the time and I don't have the emotional bandwidth to emphasize how devastating of a situation that is. It's dangerous. There's also this one time where I had a fever for 3 days, suffering from what I think was strep throat and a horrible case of mastitis while breastfeeding my 3-month-old son. And I say I think that's what I was suffering from because I never did see a doctor. We could not afford a doctor's bill, so I never got an official diagnosis. I just know that I struggled to care for a newborn while I had a fever of 103 degrees for 3 days before a family member called someone who knew someone whose husband was a doctor and begged them to call in a Z-Pack, very strong antibiotics for me. What would have happened if my family member didn't know someone who knew someone whose husband was a doctor? Where do the folks go who don't have that network of support? My husband worked in the ER for 4 years, and he'll tell you that they go to the ER, they go to the hospital. And just like we wouldn't have been able to, they are not going to be able to pay that bill. Guess who is paying those bills? I'm not telling you these stories for sympathy. I'm just trying to paint a very real picture of what not expanding Medicaid has cost Wyoming. My story is not unique. I am just able to tell it to you here now because I'm on the other side of it. I made it out, barely, but there are a lot of folks that need this desperately. They are not here testifying because they are just trying to survive, but they're out there and they are ours. They are our neighbors, they are our friends, they are Wyomingites, and we have to take care of our own.
Okay, thank you. Any questions? Well, we appreciate you joining us tonight. Appreciate your testimony.
Thank you. Thank you for having me. Thanks for letting us.
Thank you for your persistence. Yeah.
I'll be back. If you don't do this, I'll be back.
Very good. I understand Eric Boley with the Hospital Association is out there, would like to testify, and he will be the last, and then we're going to close public comment.
Yes, Mr. Chairman, I'll admit, Mr. Boley.
And Mr. Boley, brevity, please.
Good evening, Mr. Chairman.
Good evening.
Eric Boley with the Wyoming Hospital Association. I appreciate you taking my testimony tonight. As you're aware, we've been big proponents of Medicaid expansion from the very beginning, but we feel like the time is right. There are a lot of different reasons that it makes sense right now, but a lot of it has to do with changes that are taking place with the program back in DC, where we'll get an even higher match. This will actually save the state money in a lot of different ways. We could look at it from a financial perspective, where I think it makes sense. It'll bring additional money into our state, where we're continuing to cut our Medicaid program and reimbursement to providers. But I think the other important thing is this is a way for us to help our friends and our neighbors up. It's to give them a hand up. We've had a lot of folks around the state have lost their jobs, and we're seeing an increase in those that need help right now. And if we can get people in and have them seek care in the appropriate setting, we'll actually save money. We'll take burden off of the emergency room. We can help these folks get preventative care and help with their chronic disease, so that in the long run, it'll actually cost us less money. There are a myriad of other reasons that this makes sense, and we've held out for a long time, but I think it's time now to help our hospitals. Hospitals give away over $100 million of healthcare annually, and that's the cost of delivering that care. We're seeing an increase in that amount as people are underinsured and uninsured, and this would take care of those individuals that really need our help. The other thing to realize, and we talked about this, we're talking about folks that are working now, but they're not making a substantial income that can support them. 76% of those that would qualify for Medicaid expansion right now are single mothers that have 1.8 children. That's what the stats show. So 2 kids. They're working multiple jobs. They don't qualify because they don't have the income, so they can't get any of the concessions so that they can get breaks to have health care on the health exchange. And these are folks that if we help them now, they can better their lives, they can take care of their families, and we can help our neighbors. And with that, I'd answer any questions, but I appreciate you taking my testimony tonight and appreciate your hard work. Thank you.
Okay, thank you for joining us. Okay, I think Representative Hallinan has a question for you.
Thank you, Mr. Chairman. Mr. Boley, you say that the amount of reimbursement that the providers get has gone up. How much is that?
Mr. Boley?
Mr. Chairman, Representative Hallinan, I'm not sure I understand the question. We're actually seeing a decrease in our reimbursement because of the budget cuts that we've taken in Medicaid. So maybe you could clarify your question for me. I'm sorry.
Well, I thought, thank you, Mr. Chairman, a follow-up. I thought that you said that the providers were going to get an increased amount of reimbursement for their services that they provide. Is that, and how much is that?
Mr. Chairman, Representative Hallinan, we have providers right now that are receiving no money for caring for these individuals. We have individuals that are going into the emergency room, which is the highest cost for care, and it's usually not the correct setting. So what we would have is instead of not getting reimbursed, they would at least get the Medicaid rates under the expansion model.
Okay, thank you. Go ahead.
Thank you, Mr. Chairman. And another question is, how much of the deductible is there on these Medicaid policies? How much does the individual have to pay?
Mr. Chairman, Representative Hallinan, I think under our current Medicaid program, it's about a $2 copay, $3 copay. There isn't much of anything for this expansion group. I'm not aware of any deductible or out of pocket.
Okay, Representative Baker has a question.
Thank you, Mr. Chairman and Doctor. You mentioned $100 million, and my question is that based off of a formula? Because I know that the legislature has been provided that figures in the past, and it's been based off of a formula population size, or is that a hard number?
Mr. Boley.
Mr. Chairman, Representative Baker, great question. The $100 million, it's not a static number. It changes annually. It averages around 100 million. We've seen it increase at times to 125 million. We've seen it dip to about 90 million. And it's based off of our cost reports. Every hospital in the state is required to file a cost report at the end of each year with Medicare, and they use that to true up whether or not we've been under or overpaid for our Medicare services. And so it's actually a formula that is used to derive what our actual cost for that care is. The one thing, and we can spend a lot of time on this, if you're on Labor, Health, and Social Services Committee, you'd get sick of hearing from us, but that 100 million is actually not a true figure. It's low for what the actual cost is, because there are certain costs within a hospital that are not allowed under Medicare to be claimed as costs, even though they are direct costs for providing that care. I hope that answers your question.
Okay, any other questions? Seeing none, thank you for joining us.
Thanks, Chairman.
Okay, we're going to close public comment, and we're going to work this bill. And is there a motion on the bill? Been moved by Representative Henderson, seconded by Representative Yin. Okay, I see a proposed amendment. Representative Sweeney or Yin, or who wants to?
Mr. Chairman, I'd like to move proposed amendment H3701.
Okay, just for a second, everybody, do we all have this on our desk? I found this on the right side of my desk. Does everybody have it? Okay. Okay. Your motion on the amendment, and it was.
If I have a second, I'd be happy to
Is there a
walk
second?
through it.
Representative Sweeney, second. Go
So,
ahead.
Mr. Chairman, thank you. So this proposed amendment basically makes the House Bill 162 match up with the Senate file. I believe it is 154. What the Senate file does and what this proposed amendment would do would basically implement Medicaid expansion in a way that would also require us to still be in the FMAP of 55%, and if it doesn't happen, if they don't extend the FMAP percentage, which is essentially the 5% extra percentage points in the handout that you also got, that basically gives us, according to the Department of Health, a net $34 million in savings in the state general fund. We will just not have Medicaid expansion anymore. So the proposed amendment will basically put the federal government on notice that if you want Wyoming to continue to have Medicaid expansion, you need to help us pay for it.
Okay, as I look at the amendment, I mean, basically deletes the bill. For the most part, deletes the bill and inserts then this 424501. And it's really, is this the second page where you're talking about we've always had the 90-10, in every Medicaid expansion proposal, that if that ever dropped, that Wyoming was out. This includes, as I read this on line 10 on page 2, that if the FMAP changes from 55, we're out. Is that how I understand that?
That is correct, Mr. Chairman.
I think I was in the House when the FMAP changed and was lowered to the current 50-50. It's been a few years ago, but okay. Well, so any discussion on this amendment? Any members? Representative Baker.
Thank you, Mr. Chairman. This is reaching way back from a long time ago, previous discussions, but I think it's very relevant to this. My understanding is that if Wyoming ever expanded Medicaid, that the new population could never be referenced as an old population again. So we can't really do this 90-10 and do this the 55% because that population is now the old population and they're not considered new. So I probably need to refresh on that, but the concept is there that once we expand Medicaid, they are now the old population. So I don't think we can ever back
Maybe
out.
Mr. Fuchs, and I'm going to ask the department to come in. Franz, are you there? Okay.
Yes, Mr. Chairman. And Mr. Chairman, I'm happy to try to clarify that question. Our read of the new American Rescue Plan Act, and the relevant section is section 9814, if you want to read it, is that it's essentially an incentive for states that haven't expanded to expand. So what it does is it bumps the non-Medicaid expansion match up by 5%. So since our match is 50% currently, we would see a 55% match for 8 quarters, so 2 years, time limited. That is a very strong but temporary incentive for expanding Medicaid, but that does not affect the FMAP or the match for the expansion population, which remains at 90-10, if that makes sense.
So, Mr. Fuchs, then the way this is written, though, we say federal government after 8 quarters, if you drop it to 50-50, we're out. And I think,
Mr. Chairman,
then is that population, are we able to do that? Is that, and maybe Representative Baker can clarify that. So,
well, Mr. Chairman, I guess my concern would be related to the 8 quarters. If Wyoming decides then to back out previously, well, I think we're still locked in. If that's not correct, the 8 quarters, we can't back out at 8 quarters at any time. I don't think is my understanding.
Can you answer that for us?
Mr. Chairman, Representative Baker, we've received assurances
without that percentage changing.
Okay.
Mr. Chairman, I'm sorry, the Zoom may be a little choppy. I might have misread the question, but we've received assurances in the past that the Medicaid expansion, we can back out. That population would then become uninsured. And then our FMAP for, if nothing changes, the match percentage for traditional Medicaid would go back to 50% or whatever the formula is at the time. I might have missed the question though, so let me ask if that answered it.
Yes, Representative Baker is gonna.
And I may need to clarify this with other people later, but I guess if I'm understanding what you're saying is if we back out, those people then become uninsured. Is that correct?
Mr. Fuchs?
Mr. Chairman, Representative Baker, that is correct.
Okay.
Yeah, okay. Any other questions? Then, it's a good question. Okay, Representative Sweeney.
So, Franz, I should have gotten a hold of you, but in previous testimony, having been on labor health, Senator Scott has always indicated on our Medicaid portion, not talking about expansion, that other states get actually 70%. And I guess my question to you is, number one, is that correct? Like Mississippi or Alabama, I think it is, might get up to 70%. And do you think there's a way for us to continue on at the 55% with the help of our congressional delegation? And also, could that possibly drift up to potentially 60% long-term if we were to take the enticement plus lock in with the Medicaid expansion?
Mr. Fuchs?
Mr. Chairman, Representative Sweeney, your first question, yes, it's correct. Many other states receive a significantly higher match. The reason is because the formula, which is set in statute, is based on the mean per capita income of a state. So poorer states like Mississippi, compared to the national average, will obviously be much lower, so their FMAP is higher. 50% is the floor so no state can go below 50%. Wyoming's per capita income has been around 110, 120% of the national average since around 2005. So our FMAP has been, around 50% with exceptions of some temporary bumps here and there since that time. However, during the bust years when our per capita income went below the national average, our FMAP went as high as 70%, I think in the mid early 90s. So it really just depends. Based on the trend of the per capita income, I wouldn't anticipate our FMAP going above 50% just on its own. I think whether or not we can retain the 55% incentive is, your guess is as good as mine. It's kind of a game of chicken that we're playing with this bill with the feds.
Okay, any other questions? Vice Chair Henderson.
Thank you, Mr. Chairman. In the information provided in your one-page document, about middle of the page, it talks about an estimate comes with significant uncertainty, and you're 90% sure. Could you expand on that just briefly? Thank you.
I think we're referring to a white paper, March 2021, Department of Health that was created. So I think that first bullet point.
Mr. Chairman, Representative Henderson, yeah, that section sort of summarizes the executive summary of our full Medicaid expansion report, which I'm happy to provide to the committee or talk about right now. What we did essentially was we modeled, what our enrollment and costs would be. This is a pretty in-depth modeling exercise. We looked at other states' expansion experiences, based, how things have trended for them. And then we try to adjust based on the characteristics of those states, try to estimate what enrollment would be for Wyoming. And that comes with uncertainty. The model is a statistical model. So there's in this case, a 90% credible interval. We're 90% sure that the upper and lower bounds are $14 and $27 million for the state funds. There are a bunch of other parts of that model I could certainly go into, but I know your time is short. we do use Medicaid claims data, for example, to estimate the healthcare costs of those enrolled individuals and so on. But really, the most of the uncertainty comes from the uncertainty in enrollment, which we've modeled out. And I'm happy to provide kind of that report to you for your review.
Okay, very good. Any other questions on this amendment? Any questions on the amendment? Any, Mr. Fuchs, any other clarification? Okay, are you ready to vote on the amendment? Question being called on the amendment. All those in favor of the amendment, please say aye.
Aye.
Opposed, say no.
No.
I think that amendment has been adopted. Okay, so we're on this amended bill now, the amendment. Any further amendments?
Call the
Okay.
question.
Okay, the question being called, it's on as amended, House Bill 162. Please call the roll.
Representatives Baker,
No.
Gray,
No.
Hallinan, Henderson, Jennings excused, Roscoe, Sweeney, Yin,
Aye.
Mr. Chairman. Mr. Chairman, we have 5 ayes, 3 noes, and 1 excused, the noes being Representatives Baker, Gray, and Hallinan.
Well, thank you. Turn my mic. Thank you, members of the committee, and thank you, the public, and Representative Romero Martinez. Nice job on your presentation, and appreciate everybody's work, and we'll see how this bill moves forward. Okay, thank you. Have a good evening.